All right, let's get things started. Hi, everyone. I'm Jennifer Cunningham. I'm the Associate Vice President for Alumni Relations here at Lehigh and your host for today's webinar with Professor Laura Katz Olson. So how this is going to work is Professor Olson will speak for about 20 minutes, and then you will have a chance to ask questions or comment via the chat that is probably at the bottom of your screen. Just click that button. And if you'd like to just chat with me and Laura, you can say host, share with host and participants, or you can choose to share your comment and question with everyone, which I do recommend because it's fun sometimes to see the back channel conversations going on. So let's get started. Professor Olson has been at Lehigh. She told us she has a dinner tonight that her department is throwing for her to celebrate 50 years of working at Lehigh, which is amazing. She loves it here, and I think we'll get a great, we'll hear what she's been working on for the last several years at least. Dr. Olson has written several books, and we can send you some links to those books once we're finished. But let's get started.
Okay. It's a pleasure to be here with all the alumni, hopefully some of my ex-students. And I'd like to start by thanking Bryce Neff for inviting me to talk on private equity, an important topic that I think affects all of us. Private equity firms have been involved in all aspects of our lives since the 1980s, from what we drink, Dr. Pepper, where we sleep, Motel 6, how we communicate, Skype, where we obtain office supplies, staples, and the way we power our electronic gadgets, Duracell batteries. Now, with its voracious appetite, private equity is encroaching on our health, our well-being, and even our dying. If you are addicted to opioids, don't be surprised if private equity is your treatment center, or if its helicopter is swooping down at your crash site. It can be your dermatologist, your dentist, your ophthalmologist, or your gastroenterologist. You may be at their mercy in the hospital emergency room or at the dialysis center. Private equity already owns over $13 trillion in assets and employs over 12 million workers in the companies that they own. I've been studying health policy and elder care my entire career. In recent years, the word private equity would sporadically appear, but not much more. I eventually learned why there was such meager information. Private equity has a penchant for secrecy. The firms live in a darkly curtained world, protected from external scrutiny. Unlike publicly traded companies, they are not accountable to anyone other than their investors, and most aspects of their financial operations are even kept from these investors. Public entities are required to file with the SEC and disclose detailed information, which is available for anyone to inspect. Private equity only must file limited information, and even that material remains confidential. Moreover, anyone who sells a business to a private equity firm must sign a non-disclosure and non-disparagement clause. It's very hard to get information from them or about them. Previous owners of health agencies or physician practices are told that private equity will take over only the administrative burdens. The mantra is, let doctors practice medicine. The reality is that private equity takes firm control over the business or practice, especially in setting financial targets. What I'd like to do is look at how private equity works, because only if we understand the playbook can we understand the consequences for healthcare. First of all, the only goal, and I emphasize the only goal of private equity, is to earn outsized profits. What that means is that the general partners or the GPs of a PE firm must beat the stock market in order to keep their investors happy. That is because of the greater risk, of course, of private equity. Importantly, GPs or general partners don't care about the particular product or service they buy. It could be Roto-Rooter or hospice care. Like Willie Sutton, they go with the money, or they go where the money is. And it's only a certain generations that it's going to understand my reference to Willie Sutton. So let's look at the process. The process begins with a private equity firm raising a pool of money from investors for its next fund. In this case, let's say Fund 3. These investors are called limited partners. Private equity gets its money mostly from state and local pension funds, but also from university and nonprofit endowments, and also from wealthy families. These days, they're looking to get money from individuals in society. The private equity firm has up to 6 years to spend the money by acquiring stakes in businesses. They buy around 10 to 15 businesses for each fund, and this becomes part of the private equity fund. The companies are bought by leveraged buyouts, and what that means is about 60% of all the money comes from borrowing, and the company itself actually can be used as collateral. The debt is mostly through banks, although these days, other PE companies are providing the money for debt through private credit funds, which is a whole other issue, the growth of private credit funds. The private equity firm itself only puts in between 2 to 3% of the capital of the equity when they purchase a company. The rest, about 40%, is paid by the limited partners. So, for example, a company is bought for $100 million. The private equity firm might put in $2 million. The LPs might put in 38% or $38 million. And the rest, the debt, or $60 million, is borrowed. Now, this is the key. The trick is that the portfolio company itself, not the private equity firm, pays off the debt. Immediately, the private equity firm prepares the portfolio company for sale. And they do this by 2 means. First is to maximize revenue to pay off their debt, and the second is acquiring additional businesses. So let's look at the first one, which is maximizing their revenues. In healthcare, they can cut less profitable services, even if the community needs them. They can add profitable services. For example, in dermatology, instead of cancer care, they can add cosmetic surgery. They could also limit technical innovations, modernization of equipment, and R&D. They can streamline personnel, which of course is a serious issue in healthcare, given how important frontline workers are. They can use lower paid, less qualified workers, which they often do. They could lower wages and slash benefits, which also leads to greater turnover. They can intensify the workload, which means that they would basically have more patients per hour for each frontline worker. They could limit training. They could have less supervision over these untrained workers. They can use cheaper materials. They could also limit supplies. This was something that was very possible and probable in ambulance services, for example. They could upcode the insurance, so they get paid more by Medicare and Medicaid, or commercial insurance for that matter. They also hard sell products or procedures. In other words, they get people to buy procedures or buy products they may or may not need. And they could also use hardline billing, making it very hard for people to pay for long-term, for low-income people to pay for their services over time. What is most important is that these means of maximizing revenue also lower the quality of services in healthcare. Obviously, if you have cheaper materials, limited supplies, etc. The second thing that they do to maximize the value of the company is through mergers and add-ons. This too is through debt, with the companies, not the private equity firm, paying off the debt. Right now, about 60% of healthcare deals are add-ons, and this is up from about 45% over the last 10 years. There are two reasons to roll up a company, or two main reasons, I should say. One is to make the company more valuable for resale, and second, to gain monopoly status. So the first thing the private equity company does is they buy a large, prospering company or physician practice as a platform, or they can put one together. Then that company buys smaller places, either in related areas or in the same area, including competitors. Each new business adds exponentially to the ultimate selling price. The second aim of add-ons is to achieve monopoly status, whether local, state, or regional, and that's, of course, to control prices and increase prices. They can also merge with another platform company and form a national chain. Finally, the private equity firm also can add de novo companies in order to get more patients and more revenues. Immediately, private equity looks to sell and get it ready for sale. And the idea is to sell at a much higher valuation than they paid for it. So, as in the previous example, the company that they bought for $100 million, whose net debt is now paid off by that company, let's say it could sell for $200 million. Remember, the private equity firm has only put in $2 million. So where do they sell to? They can sell through the public market through an IPO. They can sell to another private non-PE company. But more and more these days, healthcare companies are selling to each other. Healthcare companies are selling to another private equity firm in secondary, third, fourth, etc. buyouts. It's like a volleyball game where the private equity companies are passed back and forth to each other. In recent years, quite a few PE shops are zooming in on healthcare. From 2013 to 2023, they spent $1 trillion on 8,000 health deals. Presently, healthcare is the second major sector for private equity investment and represents over 15% of their new acquisitions. So why are they going into healthcare? First of all, they have a huge and growing amount of dry powder with fewer retail opportunities, something like $2.6 trillion. By the way, dry powder, for those people who don't know, is money that has been pledged by the limited partners but has not yet been deployed. So they have lots and lots of money. Second is the ongoing and increased federal and state revenue through Medicare and Medicaid. For those who don't know, Medicare is 12% of the U.S. federal budget, and Medicaid is 9%, and Medicaid is also roughly 20% of all state budgets. Again, huge amounts of money. Third is the aging of the population. More people need drugs, treatments, there's more funerals, more hospice, etc., and home care, of course. Fourth, healthcare tends to be recession-proof. Much of healthcare is not discretionary. Importantly, healthcare is highly fragmented. What that means is that there's still large amounts of smaller places for them to acquire in their add-ons. Healthcare has proved highly profitable over the years. It is also a significant percentage of the GDP, something like 17.3% today, or $4.5 trillion. There's also limited regulations in many of the sub areas, such as autism, eating disorders, alcohol and drug rehab, and hospice. And finally, government policies that have opened up extraordinary revenue streams. For example, when Medicaid went from institutional care to home care, that left lots and lots of Medicaid money for home care. When Medicare included hospice in its benefit offices, in its benefit offerings, private equities swooped in. The Affordable Care Act, of course, gave more clients eligible for Medicaid and private insurance. And you also have increased diagnosis and funding for autism, eating disorders, and opioid addiction. So, how does private equity make its money? Slide 6. First of all, they make 20% of the sale price of the company in carried interest. Now remember, they're only putting in 2% of the purchase price. They are also taxed at lower corporate rate rather than the individual rate. Second, they get huge management fees. This is 2% of the committed capital in a fund every year, and this is paid by the limited partners. 3, they get transaction fees, the buying and selling of businesses, the monitoring, legal costs. This is paid by the target companies. Number 4 has become more and more popular, and this is dividend recaps. What they do is they borrow more money, put more debt on the company, and pocket that money. 5, they sell the property on their practices or companies and then lease them back. This is done fairly often for hospitals and nursing homes. This was one of the major reasons for the bankruptcy of Toys R Us. And finally, the interest that they pay is tax deductible. Okay. So one problem that you have, besides the low quality of care, is the potential for bankruptcy. In retail, there have been many, many high-profile bankruptcies. This, of course, includes Toys R Us, Payless Shoe Sauce, New England Confectionery, Claire's, David's Bridal, Gymboree, Bumblebee Seafood, Radio Shack, Staples, Sports Authority, The Limited, J. Crew Guitar Center, Art Van Furniture, and Party City. The question, debts on healthcare are increasing so much that there's a greater and greater chance of bankruptcy. Can we afford bankruptcies in healthcare? There's one thing to have a bankruptcy in Toys R Us. My daughter was devastated, and I'm sure the workers were devastated and communities were devastated. But it's not the same thing as a kidney disease patient foregoing their dialysis treatment or dermatology patients their cancer treatments. In the short time that private equity has been in healthcare, and I've been predicting this, and unfortunately I've been right, we've had a lot of bankruptcies. For example, U.S. Dermatology Partners, which is the third largest dermatology chain in the United States, they went through 3 private equity buyouts and finally went into bankruptcy in 2020. HCR Manicare, which sold the land on which the nursing home was on, and then paid huge amounts of rent and leases. They went bankrupt in 2018. We had a huge number of ophthalmology bankruptcies in the mid-1990s. Several dental practices went bankrupt in 2012, including All Smiles Dental and Small Styles. In 2022, there were 44 private equity bankruptcies, 11 were in healthcare. However, in 2023, it has picked up, and there were 80 bankruptcies in health companies, of which 1/5 or 17 were private equity controlled. These included Air Methods, which is air medical transport, Center for Autism and Related Disorders, Envision, which is staffing, doctor staffing company, Genesis Care, which is cancer treatment. The credit quality of private equity healthcare companies is falling to at-risk levels for fully 60% of all private equity health companies. 93% of these have excessive leverage. Finally, several private equity companies have made temporary maneuvers to ward off bankruptcy, and this includes U.S. Renal Care, which is the 3rd largest dialysis provider, Alara Caring, which is a home health agency, and LifeScan Corporation, which has medical supplies. Private equity contends that companies benefit from their takeovers in numerous ways. First of all, they say it helps businesses to grow and increases the supply of limited services. Yes, they are right. This is true. Private equity can add to the amount of available services through new agencies or expanding existing ones. However, these new businesses apply to the PE playbook, and therefore they are similarly of low quality or even harmful. This has been especially detrimental in areas such as home care, hospice, autism, and dialysis. Second, private equity says that they create jobs. Maybe. The evidence is mixed on this, but they are mostly these days buying each other out and consolidating, which does not add to jobs. Third, private equity says they provide efficiency in a bloated healthcare system. Yes, they do. This is true. Private equity does promote efficiency. But in healthcare, efficiency can translate into measures that undermine services, such as curtailing training, overuse of less qualified, unsupervised frontline workers, and foster a greater assembly line approach to patient care. Fourth, private equity says that they provide research, technologies, and capital equipment that smaller places can't afford. This is not necessarily true. For the most part, private equity doesn't invest in their companies since they'll be selling them in short order. Finally, they argue that private equity gains enhanced bargaining power with insurance companies. Yes, this is definitely the case. But this raises the cost for patients and taxpayers. The studies show that the higher fees accrue to private equity and their LPs and not anyone else. So what I'd like to do is name a few things that I think we need to do. First of all, we need to enforce the prohibition of the corporate practice of medicine. We can't have financial people practicing medicine. Second, we need to eliminate the tax advantages that encourage private equity. This includes deductibility of interest on debt, carried interest taxes, capital gains, etc. We also need to limit the amount of debt on companies with the strictest limits on healthcare. Remember, many of them are going bankrupt because they're over-leveraged. We also need severe controls on consolidation and monopolies applied to the healthcare sector. Currently, each add-on tends to be under the threshold for antitrust review, which is currently 111 million for reporting deals to the FTC. And finally, and most importantly, in my view, private equity should not be in healthcare, period. Thank you.
Okay, thank you, Professor Olson. We do have, first of all, I want to ask you, are you okay sharing these slides with our attendees? We
Oh,
can
sure.
see them afterwards. Okay, we had several questions about that. So yes to all the people that were asking about that. Second, there were a couple alums that were asking about that perhaps work in private equity or no. Michael asks, this is a very biased presentation. Sure, there can be issues with PE, but PE creates real value for portfolio companies and the customers. So, and Jeff was asking, similar, appreciate your decades-long dedication to Lehigh. I agree, it's a one-sided argument. So just wondering, and then also if you've consulted with the Healthcare PE Association, the American Investment Council, or the Institutional Limited Partners Association. So just maybe, you know, what's the upside of PE?
Well, I think I tried to include some of the upsides. Yeah, they can have, you know, autism services, they can expand them. So they're more available, but I'm arguing that what's available is not high quality. What I'm arguing, and I don't, okay, what I'm arguing is that the very nature of the private equity playbook, where they have to make extraordinary profits, is going to have a detrimental effect on the quality of healthcare. And if I don't see how they can, I think you'd have to be a magician to make the kinds of money on a dermatology practice that they need to make and keep high quality care.
So
I don't see how it can be done.
Yeah, some people are saying that prohibiting PE from investing in healthcare would decrease the capital investment in healthcare. So how do you make up the difference? Is that through taxes? How do companies get the capital to scale?
Well, this is a real dilemma. I mean, and this is why I look at the issue of making more places available and so on. Yes, we need more places, we need more care, but we want high quality care, not just any care. And what I'm arguing is that, and this is a dilemma, is it better to have more autism services that are not good?
Mm.
That I guess that's a decision that a society has to make. But private equity, when it deals with certain things, has low quality services, even if they make more available.
Mhm. Are taxes the way to do it, or just more insurance getting involved? Like what are some ideas that you've explored in the classroom with the students on this?
Well, I don't teach this in the classroom. But one of the things that's going on now is the question of, for example, the the add-ons, whether in fact they should be scrutinized for monopolies. Right now, these add-ons slip under the radar.
Mhm.
So a lot of private equity firms are getting their local, regional, or even national monopolies by going under the radar. And when you get a monopoly, you can control prices. And this is one of the reasons that we are having, one of the reasons we're having such higher costs in our healthcare system. Um, I mean, the basic issue, just to go back to what I said earlier, is that when you take value out of a company, you're going to hit the quality of care in healthcare. Maybe, with Toys R Us, you can have fewer retail workers. You can go into Toys R Us and you can pick out your own toy. But with healthcare, the most important aspect is the direct care workers. And this is a problem.
Mm. Um, Someone's asking about most healthcare workers are licensed. How do you presume that PE companies would use substandard workers? Because if they have to be licensed, and wouldn't increased efficiency by the private equity firms lead to lower inflation? And then what about the access of care by telemedicine, which traditional models are lacking? PE firms are more willing to invest in things like telehealth. So I guess there's two questions in there. One is, are PE companies just allowed to use unlicensed substandard work?
Well, they're using licensed workers, sometimes unlicensed, but they're using licensed workers for things like in dermatology. Study after study shows that they're using workers that are not finding cancer or that are having too many uh, procedures that are unnecessary. There's a whole literature in dermatology showing that what the workers are doing there because they're substituting physicians for people who are not trained to detect cancer or do that kind of thing.
Eric is asking, is
I,
there
I don't know the answer. It's too complicated. As far as telemedicine, I don't have any comments on that.
um, David is saying in nursing homes, they can replace RNs, for example, with lower paid and less educated LPNs, decreasing overall staffing levels, period. Eddie says, for those of you suggesting that PE is a necessity in healthcare, consider the fact that other countries spend far less on healthcare for their population and get better results without PE.
Nursing homes is another issue. I've
Mhm.
studied nursing homes my entire career, and I left them out of my book because the problems with nursing homes are far greater than private equity, and private equity just makes them worse.
Mm.
With nursing homes, we have a real issue. And if you look at the quality of care in nursing homes, every government study that I've ever seen shows how low quality nursing home care is. So it's not a place where I would uh, look for quality care, and that's a whole other issue.
Yeah, yeah. Um, Can you tell, someone is asking, is there a way to tell that your dentist or your dermatologist has been taken over by a PE firm?
What a great question.
Mhm.
Um, because I have to tell all my friends and my daughter and everybody, you got to ask. No,
Mhm.
they tend to they certainly don't advertise this is a PE owned company.
Mhm.
One of the I mean, I'm going to say something probably very controversial, but I know it's true, that one of the worst dental practices is Aspen Dental, and they've been sued constantly and more recently for poor dental work. I did a study of Aspen Dental, and all you know is it's called Aspen Dental. You don't know it's a private equity owned firm.
Mhm.
Other times they will put a different name on each one.
Mhm.
Um, so in order to know if it's private equity owned, you have to ask.
Mhm. Yeah.
And and the one thing that you would be very clear is that there's constant turnover.
Yeah.
Since they buy and sell, it may be owned by one private equity firm this year and a different one next year.
Mhm.
So it's very hard to keep track of
Yeah.
who owns a private equity firm.
Caroline says in dentistry, while hygienists are licensed, many assistants are not. PE buying DSOs or dental service organizations providing poor level of quality dental care because they're not invested in employees, people leaving left and right. They're eating up all the quality practices. And Siddharth says, my dentist provides high quality care, but goes hard selling for sure. um, how about Sandra asked, addressing the high cost of private insurance is another side where they cover less for certain services than they would help decrease effects of various conditions, leading to those who can afford out-of-pocket costs. So how does PE work with private insurance?
I'm not sure what you mean. I'm not sure I understand the question.
So maybe does when a firm is owned, when a practice is owned by PE, do they have any relationship to the insurance companies? And does that
Um,
change?
well, of course, if you get services that are covered by your insurance, they'll pay for it. If that's the question. Um, Interestingly enough, private equity is taking over all kinds of different areas outside of healthcare, and some of it is insurance companies themselves. It's really spreading very, very widely.
Mm-hmm. It
Um,
seems like we only have a few minutes left. It seems like the audience here is kind of split. Some people saying they agree, and that, a few people saying PE in and of itself is not a bad thing, but in terms of healthcare, there's a moral issue versus I think you were saying this about Toys R Us. Um, you know, no one's going to die if they can't get their toy at Toys R Us, but with medicine, it's very different. But then other
well,
people are saying it's not fair, that PE owned companies are not all bad. And PE
well,
and
yeah, I mean, I'm not saying PE-owned companies are bad or that the people are bad. I am looking at the consequences. And if you look at private equity owned dermatology, private equity owned autism, private equity owned eating disorder centers, if you look at the actual companies and you see what has happened to them and how the quality of services get destroyed, this is evidence based.
Mhm.
Study after study, the American Medical Association talked about hospitals that get destroyed because the private equity firm will sell the land, like Stewart Healthcare is totally destroyed. It has 33 hospitals in 9 states, and it's totally destroyed. One of the reasons they sold the property under the hospitals and then leased it back at a huge amount of money. They
Mhm.
then took a huge dividend recap, and the place was swarming with bats and terrible conditions. I mean, the evidence. This is not my opinion. The evidence is showing how serious the consequences of private equity in healthcare is, and it's and I predicted these bankruptcies at the very beginning. And I'm even shocked at how fast they're coming.
Okay.
Can we
Um,
afford to lose? There's one company, I forget the name of the company now. It owns 10% of all doctors. Can we afford to lose that company into bankruptcy?
Someone is a pediatric resident at Boston Children's Hospital and said the closure of Stewart Healthcare by the PE company that bought the land has been devastating to the Boston community. So,
And also they have hospitals in other places, and these are community hospitals.
yeah.
But you also had hospitals in Philadelphia that closed because they sold the land under they bought, private equity just bought the hospital to get the land, to sell the land, pocketed the money, and then we lost the hospital. So we lost a major hospital in Pennsylvania too.
Right, right. Okay, we have one more minute left. And I think again, several people are saying on here, you know, that this is one-sided. And to me, that's okay. We have a lot of chat going on, and it's I think that's part of the benefit of being in higher ed and having so many people from various, you know, a diversity of thought here. Some people are agreeing with you and giving their own examples, and some people are saying it's not fair, it's biased, but that's why we have these conversations. So I do appreciate you willing to spend your time with us. And
Let me just make one comment on the bias, okay?
sure.
I understand bias, and I understand how somebody may be very unhappy, especially if they work in private equity, with some of these conclusions. But I really encourage people, especially those who think it's biased, to look at some of these studies showing the consequences for hospice care, the consequences for home care, the consequences of private equity, and what they have done to the companies that they buy, and see how biased it really is.
Thank you for that. All right. We will end on that note, and I really, again, really appreciate your time, Professor Olson, and
It's been my pleasure.
Yes, I appreciate everybody on the call, and good luck at your dinner tonight. And again, congratulations on 50 years at Lehigh.
Well, thank you very much, and thank you for inviting me.
Okay, thank you. Bye.
Bye.